program you're about to see is one in a series designed to assist the community in getting important information about mental health issues. It's sponsored by Community for Hope, an Oshkosh suicide education organization founded in 2001. This volunteer-based group was established in response to a number of teen suicides in the Fox Valley. Since 2001, Community for Hope now focuses on mental health issues facing all age groups. For more information on this program or on Community for Hope, please visit www.communityforhope.org.
Hello. Do you know someone who has died by suicide? The chances of you answering yes are very, very high. When a teenager dies by suicide, it captures attention, especially among his or her peers. Many of us, in fact, are under the impression that suicide is most rampant among teenagers, but turns out it's not. The fact is, more people over 65, especially men, die by suicide than any other age group. But there are indications that trend may be changing. That's one of the things we want to talk about in this program, suicide myths. And with us today is Shelley Rutz. She's a clinical social worker, has been for the last 5 years at UW-Oshkosh. Shelley, thank you so very much for joining us. Let's talk about this thing, first of all, with, we hear all the time about young people committing suicide. If a student at West or North or Lourdes, God forbid, should die by suicide, it's all over the city. Are they the ones that die by suicide the most, or is it in fact the older people?
Men, white men 65 and older, are more at risk than kids, teenagers 15 to 24. Suicide is the second leading cause of death for 15 to 24-year-olds, but we most definitely see a higher incident rate among older males, and followed by African American males and Native American males.
What about here in our backyard? 65 and older white men, what triggers them to want to commit suicide or die by suicide?
I think the same risk factors that impact anybody who gets to a level of pain that they start thinking about wanting to end their life. Depression, anxiety, where you start to feel hopeless and helpless. I think by the time you get to be 65, there are some more triggering events, some more losses, loss of a partner, loss of a home, loss of major changes going on in life. And depression can sometimes be triggered by those events. And if that person doesn't get help, and this goes on for a while, they're going to start feeling worse and worse and worse, and feeling like nothing's ever going to change, nothing's going to end.
You talk about pain. Yes. What are we talking about? My knee hurts, my elbow hurts, I got a headache, what?
I'm talking about psychic and physical pain. So for a lot of people with depression or anxiety, it's a deep unease. Sometimes it can feel like there's concrete blocks strapped to your feet. It's this emotional pain of not being able to snap out of it. It's the pain of feeling ashamed that you're feeling this way and can't snap out of it. And a lot of people also will feel deep physical pain all over, sometimes in their heart, sometimes, especially in different cultures, in the Hmong community, when there's emotional pain, that's centered more in the abdominal area, the liver. So, but it can just be a heavy pressing, or like it's difficult to even get out of bed or move.
Now we talk about the fact that we hear a lot about young people dying by suicide, and the fact is that it's older white men that do, but does this type of death, does it know any socioeconomic borders, or does it cross and hit any age group?
Yeah, there's no borders. When I'm doing my trainings at the university, what I tell people is if you are a living, breathing person, you're susceptible to stress, depression, anxiety. And if we don't get help, there's some people that can feel depressed and anxious, never think about suicide. But we know that there are some people, 20%, who might start to think about not wanting to be this way anymore.
How about professions? I mean, I read and I've heard and I know of law enforcement people seem to be a very high risk.
Right.
Lawyers.
Right.
Are there certain professions that you should pay a little more attention to as far as potential, if I dare say the word, candidates for this thing?
You know, I think most definitely when you're looking at high stress professions, that's going to be one of the risk factors. That doesn't mean that all law enforcement are going to be thinking about it more, but we do see incident rates higher in higher stress professions. For a while, air control personnel, were at risk, traffic control. So, but I think there's basic warning signs and risk factors that we see across age groups, careers, professions, that we need to look at and be aware of.
Okay. The myths of suicide.
Right.
One myth is that there's always warning signs. True or false?
What we're looking at nationally is treating this suicide as a public health issue, that it's very treatable and preventable. And the warning signs are stemming from depression, anxiety, manic depression. So often somebody is displaying warning signs, usually depressed symptoms, anxious symptoms. And they often tell somebody. There are studies that show that even 50 to 60% of our youth will tell somebody, but often are showing warning signs of withdrawal, isolation, of agitation, not being able to focus or concentrate, complaining of tearfulness.
But how many of us, Shelley, are kind of blow these people off? They're having a bad day or they're having a bad week.
Absolutely. And that's what we talk about is so often our knee-jerk reaction. To see somebody in that level of pain can be scary, or we want to think, oh, they're going to be all right. And instead of a red flag going up to say, hey, what's going on? You're not acting yourself lately. We say a common reaction is, oh, come on. It can't be that bad. Of course you're not a burden. We love having you here. Or we'll say, especially parents, or kids. So say having an elderly parent who's talking about this. What are you talking about? You've got all of us around. How could you be unhappy? Or we can say to our child, look at everything I'm giving you. You have nothing to complain about. And we miss the cues there, that what's going on that person's unhappy. And let's look at that, because it might not be rational. Depression and anxiety can have a way with altering our biochemicals in our brain so that we're not perceiving things accurately.
So when do you pay attention to something like this? Let's say I'm having a bad day.
Sure.
Or a bad week, which I've had in my lifetime. I think we've all gone through that.
Yes.
When do you pull the trigger and say, you need help? Or when do you say, they're okay?
Right. I most definitely have my listening ears on, and I'm thinking I want to be tuned in to what that person's saying, and when they're saying they're having a hard time, I want to talk about it, look into it. If I'm a family member or a colleague and I notice the person with me that for a week or 2 weeks, nothing's changing, I'm really going to be approaching them and saying, you seem different lately. Do you want to talk about it? Or it might be really helpful to go talk to somebody about this.
How fast does somebody go from anxious depression to death by suicide? Is there a time lag there of a month, or does it happen within a day?
I don't think there's any.
There's no Bible thing.
There's no
dictionary
cookie cutter.
Definition of suicide.
No. For some, and we have to really look at alcohol and drugs are involved with 50% of attempted suicides. So risk certainly goes up when somebody is drinking or using drugs. And sometimes we see the drinking and the drug use because they're self-medicating. They're wanting to numb that pain. And of course, if we're self-medicating with alcohol or drugs, we're more impulsive. We're more likely to do things that we're not thinking of doing.
So would you say, 90, 95% of the time there's a warning sign of some sort? or am I putting it too high?
Of people who said that they've thought seriously about suicide, 50 to 60% say, actually 50 to 75% have said they've actually talked to somebody. I believe that there are warning signs when somebody is feeling emotional distress, depression, or anxiety. If there's increased alcohol or drug use, that's also a warning sign. So that person's not going to be coming up to you and saying, I'm suicidal. Okay, they're never going to be that obvious. It's going to be changes in their behavior. It's going to be more sadness, more isolation, not wanting to talk to people. With our younger generation, Facebook, MySpace, instant messaging, all of that, our blogs are a great way of finding out what people are thinking because they are logging it. And that's something we're training our staff and residents life at the university to be aware of. And often residents will say, my friend just left this weird away message talking about not wanting to be here anymore. Should I be concerned? Things like that are also warning signs.
How many times, we've only got a couple minutes left in this segment, but we can talk about other things, but how many times does the person who is contemplating suicide want to be saved? The vast majority, or is it
When somebody's suicidal, it's not about wanting to die. It's about not wanting to feel this way anymore and not really knowing how to do that. And that's why we're taking so much time to train those who are around them, the friends, the family, because they're more likely to link that person to help than that person who's in that much pain. 20% of people struggling in this way are going to go to a mental health professional, but 60 to 75% are actually trying to talk to people about it.
Would it behoove me, whoever this person may be that I'm thinking has got showing some signs, to get them help regardless?
Absolutely.
Don't hesitate. Better safe than sorry, is the old adage.
Absolutely. Absolutely. It's much better to be thinking this person needs help, and better to be safe than sorry.
But
yes.
he or she's going to be mad at me if I turn them in, so to speak.
Not always. Some of them will feel a sense of relief. If you believe them and believe their pain and ask them about it, you're opening the door for them to talk about something that they don't know how to talk about a lot of the time.
And finally, in this part, how many people don't want to turn me in because they're afraid I'll never talk to them again? Is that the biggest overriding factor why a lot of people just don't want to turn somebody in?
Most definitely I see that with our younger generation, and also our own denial. We don't want to believe that somebody could be in that much pain they would actually do it. And we have to realize that there's nothing wrong with getting help. And getting out help earlier on is much better than waiting for that person to be in crisis or thinking you have time and it's too late. So we really want to be paying attention early on.
Okay, there are other myths about suicide that are equally as interesting, if I can put it that way, and we're also seeing a little bit of a change where suicide up until now has been like a one-person event. We saw an incident recently down at Northern Illinois University and also at Virginia Tech, and we're going to talk about if that's a new trend or what when we come back.